I'm with EverydayFamily.com. We are a pregnancy and parenting website with over 4 million members. And I'm really, excited to talk to you guys about this because it's a pretty serious issue that a lot of women of childbearing age don't know. We don't know when we're pregnant. Sometimes you come later. So we need to start looking at the things that we're putting into our bodies when we're thinking about getting pregnant to make sure that they're safe for the baby. So Let's just dive right in. And I was hoping you could tell me a little bit about the findings of a new study on antidepressant medication and women of childbearing age.
Absolutely. So in this study, we found that about 15%, or 1 in 7 women of reproductive age with private insurance filled a prescription for an antidepressant. So as you said, 50% of pregnancies in the United States are unplanned. And so oftentimes women may be taking medications and not know they're pregnant yet. And so it's important for women to talk to their healthcare providers about all the medications that they are taking as soon as possible, ideally before they would become pregnant.
Yes, definitely. Definitely. Now, why is it important that we know how many women of childbearing age are taking antidepressants? Like, why is that number important?
I think that number is important because it just points out how common antidepressant use is. And we don't want women to feel stigmatized or ashamed. We want women to realize it's very common. Depression's very common. Antidepressant use is common. Pregnancy is common. It's the same women. Your talk show is called Everyday Families, right? It affects a lot of everyday families. And so we really want folks to realize that this is something to talk about. And we're encouraging women to talk to their healthcare provider and discuss their personal situation. What's the best medication?
That's a very good point.
Yeah.
That's a very good point. Because people do, I think that it's such a hush-hush thing. And so they're ashamed or something to bring it up. And it is important. So what do you say to women who want to become pregnant or already are, and what they should do?
We suggest that women talk to their healthcare provider, ideally before they become pregnant, but if not, once they become pregnant, and think about the best way to, again, weigh the risks and benefits of medication and untreated depression. Untreated depression has risks both to moms and to families, and so we shouldn't minimize that at all. At the same time, as an example, you may have been taking 2 or 3 medications to control your depression, and in anticipation of pregnancy, perhaps there's a way you could add talk therapy as an example and maybe target that down to 1 medication. So there's things you can do.
Some medications are probably, they're not created equally. Some are maybe better than others.
That's right. And for different gestational ages, like some medications may have a greater risk profile earlier in pregnancy versus later in pregnancy. So it depends where you are. Ultimately, the goal is that we want moms to be healthy, so we are not encouraging stopping your medication. That's not the right solution. There's many instances where medication is the right choice, but we're really strongly encouraging, have the conversation, look at the situation, customize your healthcare plan so that you can be feeling well and healthy and have good mental health, and at the same time, have a healthy pregnancy outcome.
Protected. Yes, wonderful. So tell me, how are the March of Dimes and the CDC working together to help educate women about the safe use of medications in pregnancy beyond these lovely interviews that we're going to share with all of our members, of course?
Absolutely. So CDC and March of Dimes, we've actually had a long history of working together to help educate women about having a safe, healthy pregnancy and a healthy baby. And so this is our current effort of working together on the Treating for Two Safer Medication Use in Pregnancy initiative. And Treating for Two is really focused on providing better research and reliable guidance so that women and healthcare providers can make informed decisions when they're having these conversations. That's so important that women talk to their doctors, yes.
So where can we find this information? You guys, I know you've done all this research and these studies, and you've got it for us. So where do we get it? Where can we send our members to make sure that they're looking at the right information and getting, that to take to their doctors?
For sure. We have great websites. So cdc.gov/treating-for-2 is a part of the CDC website that's targeted on this issue of medication use in pregnancy. And then marchofdimes.org has information for both patients and providers in Spanish and English. So we have, as you say, a wealth of information, and we invite women and families to learn more and then go talk to their doctor.
Wonderful. Well, thank you so much. This is a really serious topic, and I'm glad I'm, getting it out there, and we're going to get more people talking about it so that, we can make sure we can prevent as much as we can happening to these little babies, right?
Absolutely.
Perfect. Thank you so much.
Wonderful. Thank you. Have a great day.
Thank you.
You too.